So, as a continuation, guys, we'll be discussing your fertility awareness method. So, from the term itself, these types of contraception, guys, you have to be aware when you are fertile, kung kailan ka fertile as a woman, okay? So, etong fertility awareness method, guys, no, I personally do not like this because it seems like contraception is just the responsibility of the woman, okay? When in fact, it takes two to tango, di ba? So, ayun. But if this works for you, no problem, okay? Fertility awareness method. For this one, guys, there are considerations that we have to follow. Ayan. So, pag sinabing considerations, the concepts of your fertility awareness method, they bank on this idea. Ibig sabihin, ito yung mga basis nila, okay? For them to be effective and for you to follow through. Kailan yung safe days and unsafe days mo, okay? So, the consideration number 1, ang typical sperm survival natin dito, guys, to base the safe and unsafe days, we usually consider it 3 to 4 days. Ayan. So, the sperm can survive inside the vagina, okay, of the woman within 3 to 4 days. Klaro ba yun? Yes, yan yung isa sa considerations natin dito when we discuss the safe and unsafe days. Number 2, sa typical survival naman of the ova. Typical survival of your ova or your egg cell. Guys, 1 day lang. Okay? Isang araw lang siyang mabubuhay. After that, wala na. Okay? Maaagnas na siya. Okay? Number 3. If you look at that, 3 to 4 days and 1 day, ibig sabihin you have 5 days fertile before ovulation and 1 day after. Tama? Yes, kasi sabi natin, the sperm can survive within 3 to 4 days, edi 5 days fertile ka before ka mag-ovulate. And once you ovulate, the release of the egg, that's ovulation, 1 day lang siya viable. After that, wala na. Hindi na siya viable. Edi 1 day after ovulation, you are also on your fertile days. So, why do we have to be aware of this? From the word itself, fertility awareness method, dapat alam mo kailan ka fertile. So, 5 days before your fertile day, do not have coitus. And then, 1 day right after your ovulation, do not have coitus. These are your unsafe days. Ibig sabihin, you may get pregnant when you have coitus within these days. Correct ba? Yes, so these are the considerations, guys. Now, let's look at the different fertility awareness methods. Ang first dito, guys, I know you're familiar with this. You have your calendar method. This one is also termed as your rhythm method. That's your calendar method, guys. Ito, dapat meron kang criteria na ginagawa dito, guys. Criteria for this one to be effective. Dapat mag-keep ka muna ng diary. Diary of menses. Diary yan, guys, ha. Keep a diary of menses for 6 months. This is for you to track how long and how short your period is. Okay? Yung mga previous period mo, dapat within 6 months, you take it before you start with your calendar method. So, guys, 6 months. Yan, dapat may diary ka for menses mo. Okay? Diary, that's diary. So, ang gagawin mo dito is ano? Once you are finished with the 6 months, because it will tell you when is your day of fertility or your unsafe days and your ovulatory days. Klaro ba yun? Kailan ka nag-ovulate? So, kailangan mong i-keep muna. Ano yan? Diary. Isa yan sa favorite na question ng board exam. Kaya dapat, i-highlight mo yan. Gaano katagal ka dapat may diary, guys, para ma-apply mo ang calendar method? 6 months. Kalahating taon, okay? Kalahating taon ka muna mag-abstain. Hindi naman. Kalahating taon muna, okay, mag-practice ng safe sex before you can effectively execute your calendar method. So, for this one, ang goal mo lang talaga dito for the calendar method is to detect your first fertile days. Ayan. Your first fertile day and your last fertile day. Kailangan alam natin yan. Within these days, guys, the first and the last fertile days, you will not have coitus so that you don't have sex. That's your contraception. To avoid conception. Kaya ba yun? Yes. So, the first fertile days, guys, ang gagawin mo, you have to subtract 18 from your shortest cycle. Okay? Guys, subtract 18 from your shortest cycle. Kaya kailangan mo ng 6 months period. And on the last day, guys, you have to subtract 11 days from your longest cycle. Ayan. So, subtract 18 on the shortest, subtract 11 on the longest. Okay? The way to remember this for this one, guys. Diba? S for shortest, ang S andun din sa 8. So, pag kinumpleto mo yung dalawang S na magkaharap, 8. Edi 18. Longest naman, guys, L, letter, parang ganun lang siya, strand. Edi dalawang ganyan, ayun, 11. Okay? So, S, kabilang S, 8, 18. L for the longest, pag dinalawa mo, 11. Ayun. So, don't forget, you subtract 11, that's your last L for the longest, for the last fertile day. And then, shortest naman is the first. That's your minus 18. Kada ba yun? Yes. So, anong significance nito? Basically, on the first and the last day of your fertility, guys, huwag kang makipag-coitus so that you don't get pregnant. Correct? Yes. Don't forget, you have to keep a diary for the 6 months of your menses. Klaro? Yes. Number 2 naman, guys, we have your basal body temperature method. So, this is what we term as your BBT, basal body temperature method. Guys, makinig ka. When you say basal body temperature, base at the base, the lowest. Guys, this is the lowest temp of your body as a woman. And that lowest temp, guys, it's not because of anything, hindi yan dahil sa sakit or whatever, in the physiologic, okay, aspect of your body, that's the most normal, lowest body temperature you have. That's your basal body temperature. So, why is it important to take your basal body temperature? When you say basal body temperature, that's the lowest temperature of your body. Is it normal? Yes. Is it abnormal? No. It's not because of illness. It's not because of anything. It's part of your physiologic response to the hormonal changes of your body. That's your basal body temperature. The normal, lowest temperature of the body of the woman. Now, anong significance nito when it comes to ovulation? Guys, in your BBT method, you are looking for the slight dip and the sudden increase of your temperature. Kasi guys, normally in your cycle, okay, simplify lang natin. Normally in your cycle, ang BBT mo hindi yan nagkakalayo-layo sa agwat. It's just point something agwat na maintained naman siya dyan. And it's a low temperature. And then when you notice a slight dip and then increase, again, notice a slight dip and increase. That's a change in the hormone of your body that will signify your ovulation. Kara ba yun? Yes. So, basal body temperature is the lowest temperature of your body. The slight dip and sudden increase will tell you you're ovulating. Klaro? Yes, that's what we are detecting in your BBT method. Kasi gusto natin mag-avoid ng coitus when you have observed the dip and the sudden increase of your temperature because it means you have ovulated. Klaro ba yon? Yes. Okay? Again, what's the reason for a slight dip and increase of your temperature? Your hormones. So let me just simplify this so that you don't go back to your menstrual cycle, hormones, and everything. Guys, the hormone of the female is estrogen. The hormone of the woman or the mother is progesterone. Tama ba? Yes. So, ikaw na dalaga, maraming estrogen sa katawan mo. So, normally, when your estrogen is there, estrogen does not promote body heat. So, actually, it lowers your body heat. So, in the BBT, guys, mababa pa ang temperature mo kasi hindi ka pa nag-ovulate, normal na babae ka lang. The moment nagkaroon ng dip and slight increase, it's because the hormone of the mother, after you have ovulated, comes out in preparation for pregnancy. What did we say is the hormone of the mother? Is that progesterone? Yes, okay? So, the slight dip, guys, is the loss of your estrogen, and then the increase of the temperature is the increase of the progesterone hormone. Okay? So, if you look back at your menstrual cycle, it's because when you release the egg cell, yung naiwan na corpus luteum, they release a lot of progesterone. And the purpose of the progesterone is just to make the uterine lining rich so that during implantation, tulad na na-mention natin kanina, which is essential for getting pregnant, can happen, okay? Kasi may rich source of nutrient ka sa lining ng uterus. So basically, yung trend ng temperature na nakikita mo sa BBT, yun lang yun, okay? Let me just simplify it again. As a woman, your hormone of the dalaga is estrogen. So you have estrogen in your body always, so kaya ang BBT mo is just slightly lower. When the estrogen is gone, there's a sudden dip and then rise of the temperature kasi lalabas ang hormone ng mother, which is progesterone, in preparation for pregnancy. So think, why the hell is your body preparing for pregnancy? Kasi nag-ovulate ka, correct? Yes, okay? So if you understand the body in that sense, it's easier to understand the changes in the hormone of the body, di ba? While dalaga ka pa, you have estrogen. Nandyan siya sa katawan mo. So ang temperature ng katawan mo, hindi naman ganun kainit, okay? The sudden dip and the rise of your temperature in BBT will signify you have ovulated and nandyan na ang hormone ng mother trying to prepare the uterine lining so that you can implant the fertilized egg. Klaro? Yes. Okay, so yun yung gusto mong iwasan sa BBT, guys. The sudden dip and increase of temperature will signify ovulation. Do not have coitus. Avoid coitus. Klaro ba yun? Avoid men in those days. Okay? So, that's your BBT, your lowest body temperature. So, guys, kailan mo to ita-take? Guys, you have to take your temperature every morning. Every morning before awakening. Ayan. So, strict tayo dito. When you say you take your temperature before awakening every morning, guys, that's your oral and your axilla temperature. Sa bunganga at saka sa kilikili. Before awakening. Guys, pag dilat lang ng mata mo, lagay mo na agad ang temperature. Hindi ka pwedeng maglakad, hindi ka pwedeng tumayo, hindi ka pwedeng bumangon. All of these will change your BBT. Your BBT is the moment you open your eyes, okay? Yung temperature ng katawan mo when you open your eyes after you have slept, okay, is your BBT. Any movement of your body will change your BBT. That's why if you really want to prevent pregnancy by using the BBT, you have to use it conscientiously, okay? So you use it conscientiously by taking your temperature the moment you open your eyes, okay? Do not get up yet because the moment your feet hits the ground, the moment your body parts hit the air, okay, it will change your BBT. Klaro ba yon? Yes, kaya seryoso yan. Take it every morning before awakening. Now, we have a metric here. Dapat ang babae meron siyang 4 hours of uninterrupted sleep for BBT to be effective because low sleep hours will have an effect on your BBT. Klaro ba yon? Yes, will change your BBT. Will change the hormones in your body. Klaro ba yon? Yes. That's why dapat meron kang 4 hours of uninterrupted sleep. Paano naman, ma'am, yung mga night shift girlies natin? So, kapag ikaw ay night shift, edi take it when you wake up. Take upon waking up. Ano ang ating metric? Dapat, ma'am, meron kang 4 hours of uninterrupted sleep. Klaro ba yun? Yes. So, kasyo night sleep ka, night sleep. So, kahit night shifter ka, as long as you have 4 hours of uninterrupted sleep, that's the best time to take your BBT. Take it upon waking up before awakening. Before ka tumayo. Okay? Before ka gumawa ng kahit ano in your waking up time as a night shift girly. So, ano yung tinitingnan natin dito, guys? We're looking for the slight dip followed by a sudden increase of your BBT. Yan ang hinahanap natin. This one will mark your ovulation. Ano yan? This one will mark your ovulation. Klaro ba yun? Yes. So, when you say slight dip, the temperature we're looking at is 0.5 to 1 degrees Fahrenheit. So guys, tingnan mo yan ha. Anong nilagay ko dyan? Fahrenheit. Fahrenheit yan, hindi yan Celsius. Klaro? Yes. So 0.5 to 1 degrees Fahrenheit. Yan yung slight dip na hinahanap natin, guys. That will signify our ovulation. And then there will be a sudden increase of your BBT. Guys, the increase of temperature is within 0.2 degrees Celsius. Oh, okay? May pinagkaiba yan, guys. This one is already in Celsius. Klaro ba yun? Yes. So, guys, since sobrang hina ko sa math, kayo na ang convert into Celsius and Fahrenheit. Basta ang hanapin mo sa board exam, the sudden dip of the temperature is 0.5 to 1 degrees Fahrenheit. And then the sudden increase will be in 0.2 degrees Celsius. Klaro ba yun? Yes. So, that's your BBT. Klaro? Yes. And guys, kapag ito BBT ang ginamit mo, the failure rate is well within 25%. So, medyo mataas-taas din yan. Ibig sabihin, guys, BBT can fail you. Okay? Kaya you have to follow it conscientiously. Conscientiously. So, that's number 2, your BBT. Number 3 naman, guys. We have your cervical mucus method. This one is also termed as your Billings method. Yan siya. Ayan. That's your cervical mucus method. So, from the word itself, guys, you are looking at your what? Cervical mucus. So, guys, ang essence lang naman talaga nito is, the cervical mucus of the woman will change if it wants the body to get pregnant or not. Okay? So, kaya kung mapapansin mo, as a woman, may iba't ibang cervical mucus tayo. So, all throughout your cycle, it changes. Okay? It changes because of the hormones that you have in your body. Just like how, when you take hormones, the cervical mucus can also alter to prevent pregnancy. Tulad ng sinabi ko kanina, tama? Yes, kasi naturally, your body will allow pregnancy kapag gusto niya talagang maging pregnant, di ba? Such is the body of the woman, okay? Such is the body of a person. So, if you wanna get pregnant, the cervical mucus should be slippery so that the sperm can swim properly. Should be thin so that tatagos lang ang mga sperm. Klaro ba yon? Yes. So, eventually, all of this will make sense if you analyze things that way. Tama ba? Yes. So, guys, cervical mucus. Eto, pag tinignan mo yan, guys, it will change during ovulation. Kapag ikaw nag-o-ovulate, the cervical mucus will become copious. When you say copious, guys, sobrang plenty. Okay? Oh, di ba? Parang waterfalls. Plenty. Copious amounts of cervical mucus that is very thin, very slippery, and clear as daylight. Okay? Guys, clear siya. Sobrang linaw niya. Crystal clear. And again, all of these has to happen so that your dear sperm cells can swim properly. Okay? Kaya dito natin ipapasok ang concept ng spin bar K. Ayan. Spin bar K, potato, they are just the same thing as long as correct ang spelling. Spin bar K, guys, that's the stretchability of your cervical mucus. So, when the mucus is able to stretch for at least 1 inch, or when you say 1 inch, that's 2.54 centimeter. Okay? We have learned our mistake from the previous board exams. You have to know. Okay? 1 inch is equivalent to 2.54 centimeters before it breaks. So, anong gagawin mo, guys? So, you get your cervical mucus, you assess it, you put it on your 2 fingers, and then you try and stretch. Dapat it can stretch until 1 inch, okay, or 2.54 centimeter. So, that's the sign of the stretchability of your mucus. So, if it's able to stretch, you call that sign spin bar K. Excuse me. But if you are infertile, guys, pag hindi ka fertile, you are unable to get pregnant, your body will also follow suit. So, your cervical mucus will also follow suit. Pag infertile ka, you have your thick cervical mucus. So, if the cervical mucus is thick, hindi makakapasok na maayos yung sperm, guys. Imagine ha, sperm are microscopic cells. So, if may thick cervical mucus ko na nakabara dyan sa cervix mo, hindi talaga sila makakadaan, okay? Kaya, anong ginagawa ng mga pills natin? It will thicken the cervical mucus so that the sperm cannot pass, okay? Like your hormonal contraceptives, okay? So, that's where they have an impact. So, dito lang, kapag ikaw nagpa-practice ng cervical mucus method or your billing method, you have to look for your spin bar K and your copious, your waterfalls, and then your clear, your stretchable, and your slimy, slippery cervical mucus. Okay? So, anong gagawin mo, ma'am? Kukuha ka lang ng sample. Okay? Papahid mo lang sa finger mo and then try to assess for spin bar K. It should stretch for at least 1 inch before breaking. Okay? Or 2.54 centimeter. And remember, guys, the same lang yan ang failure rate nila. The failure rate of this one, just like your BBT, is about 25%. So, something about mga fertility awareness method, they kind of have similar failure rates, guys. And it just shows that they are not as effective as other contraceptive methods. Correct? Yes. Okay? So, guys, that's number 3. Your cervical mucus method. And number 4, guys, you have your symptothermal method. So, from the word itself, symptothermal, sympto, ibig sabihin guys, signs and symptoms. Signs and symptoms, including your cervical mucus, okay? Including the changes in your body, ayon. And then thermal, you're talking about your temperature, di ba? Your temperature. So, ibig sabihin guys, it's a combination of your signs and symptoms and your temperature method of preventing pregnancy, contraception. Okay? Kaya nga tawag natin is fertility awareness methods. Correct? Yes. So, dito, anong kino-combine natin? Guys, that's your billings, di ba? Signs and symptoms. That's your billings or your cervical mucus method plus ano ba yung temperature natin? That's your BBT method, okay? So, kino-combine lang natin sila dalawa. What did we say about your billings method or your cervical mucus method? Your cervical mucus will change if the body wants to get pregnant or because of the hormonal changes. So, dapat copious, slippery, clear, okay? To allow for the sperm to swim. Plus spin bar K. Dapat ma-stretch siya within 1 inch before breaking. Plus BBT. Anong hinahanap natin sa BBT? The slight dip and sudden increase of your temperature or your basal body temperature should be present because it will signify your ovulatory day or your ovulation. Correct? Yes. So combine these two, you have your symptothermal method. And aside from that, it's your symptothermal method where we will insert the concept of your metal smudge. Metal smudge, guys, the word metal, it will mean the middle pain. Okay? Or if not middle pain, mid-cycle pain. Okay? Mid-cycle pain in the abdomen. Ayan. So, that's your metal smudge. So, metal smudge, just remember, this is felt either sides of the abdomen, guys. It's either on the left or the right side of the abdomen. So, yung metal smudge, this is the one that will indicate which side of the ovaries, of your ovaries, ang nag-ovulate. Okay? So, ang metal smudge mo is sa left side, it's the left ovary that ovulated. Okay? Kasi we believe that the release of the ova will cause a little bit of pain. Okay? On the area or the ovary na nag-ovulate. So, metal smudge will tell you that. Klaro? Yes. So, yan. If it's the right side of the abdomen that has pain during ovulation, it's the right ovary that ovulated. Okay? A mature egg cell. And lastly, guys, number 5, you also have your standard days method. So, this standard days method, guys, it's the use of your cycle beads. That's why it's called cycle beads method as well. So, etong cycle beads method, guys, nasa book kasi siya. I'm not pretty sure if meron din tayo sa Philippines, but it's worth knowing. Tama? Yes. So, basically, from the word itself, cycle beads, gumagamit ka ng mga beads para siyang necklace. And beads have different colors that signifies what's happening in your cycle. Kung kailan ka magme-mens, supposedly, expected mens mo, expected fertility days, and expected safe days, kung kailan ka pwede makipag-coitus. Okay? So, tingnan natin itong standard days method, guys. Remember, ito siya, pwede lang itong gamitin, used in women na may 26 to 32 days cycle. Ayan, so, ibig sabihin, ginagamit ito ng mga babae na regular ang cycle, guys. So, kung ikaw yung klase ng women na may absent menses for 2 to 3 to 4 months, you cannot use this. This is unsafe for you. So, cycle 26 to 32 days, basically, pag regular ang cycle mo. Klaro ba yun? Yes. Ano yung colors na meron tayo dito, guys? Meron tayong red, nag-iisang red, brown, and meron tayong white beads. Ayan. So, yan ang mga colors na meron tayo. So, tingnan natin kung ano meron dito sa cycle beads natin. Guys, firstly, ang makikita mong first bead dyan, that's your red bead. So, si red bead, this one should be placed on your first men's day. That will indicate your first day of period. Doon mo siya ilalagay sa red bead. So, there is a band dyan sa beads, guys, na dapat ina-advance mo every day. So, pag nasa mens ka first day ngayon, i-advance mo siya doon sa red bead, ang nag-iisang red bead ng cycle beads mo. So, when you put it on the red bead, that will signify that's your first day of cycle. And then, all throughout the days of the month, i-move mo siya 1 bead per day. Okay? 1 bead per day. So, from the onset of the menses, red bead, forward you go to the brown beads. So, that's the first bead. And then, it will be followed by 6 brown beads. The 6 brown beads, this will indicate your safe days. Okay? Safe days. Kaya guys, no, kung mapapansin nyo, there are people who practice coitus during their menses, okay? Or days right after their menses. Kasi it's considered safe days. Because ang pinaka-telling talaga that you are not ovulating or you are done ovulating or you are not fertile is kapag nag-mens ka. Tama? Yes. Kasi diba, sabi natin, when you are menstruating, that's the natural way of your body getting rid or shedding the uterine lining kasi walang na-implant. Tama? Yes. So, i-shed na yung uterine lining to start the cycle again. Okay? Tapos, gagawa na naman siya ng lining ng uterus to prepare for implantation. Pag hindi nag-implant, walang implantation nangyari, mag-shed na naman ang lining, hence your menses. Tama? Yes. And the cycle goes on. So, kaya, sa iyong cycle beads, the first bead is the red bead indicates your menses. The next 6 brown beads will tell you your safe days. So you can have coitus, claro, without the fear of getting pregnant. And then after the 6 brown beads, it will be followed by 12 glow in the dark. Ilagay natin specifically kasi glow in the dark talaga siya, guys. Glow in the dark white beads. Ayan. So, basically, pag sinabi nating white beads, guys, these are the beads that will tell you you are fertile. Ayan, fertile. Kulay ng itlog, kulay ng ova mo, white. Okay? Ayan, so that's your glow-in-the-dark white beads. 12 days yan sila, guys. 12 beads, equivalent for 12 days. Okay? So, ibig sabihin, fertile ka sa days na to, do not have coitus. Klaro? Yes. And then, it will be followed by another 13 brown beads, which will indicate, pag brown, ibig sabihin, safe yan, guys. So, safe days na naman yan. Another 13 days for you to have safe coitus. Klaro? Yes. And then, guys, don't forget, within these 30 brown beads, remember, after 7th brown bead, there is a 1 dark brown bead. Ayan. So, papakita ko yung picture. Ayan. So, dito, guys, meron kang 1, 2, 3, 4, 5, 6, 7. After ng 7 na brown beads mo dyan, there is a dark brown bead. So, ano yung ideal na gusto natin pag gumagamit tayo ng beads, guys? Cycle beads. Dapat sa red dumating ang menses mo. Klaro? O, di ba? So, dapat ganon. Yun yung ideal natin kapag sa red dumating yung menses natin. So, this is all just following the colors of the bead to determine what's happening in your body. If your body is viable for pregnancy. Klaro ba yun? Yes. So guys, that's it for your fertility awareness method. Meron ka lang naman 5 dito. The first one is your calendar method. The second one is your basal body temperature method. And then you have your cervical mucus method. And then you have your symptothermal method. And lastly, your cycle beads.